Hey there, Elizabeth Scala here. Welcome back to another video in our series, Elbow Surgery from the Patient's Perspective. So I am a person who went through elbow surgery and continues to heal subsequently afterwards. These videos and this series are intended to help you, inform you, give you tips and suggestions. If there's a topic that you want to hear more about, leave a question or comment below, as I'm happy to touch on areas of your interest. In today's video, I'm going to talk about exercise, movement you can do after elbow surgery. So initially, after surgery, you will likely be in a hard or molded cast that's wrapped very heavily in gauze and has padded cushioning on either side. So your arm will be immobile. In my case, that wrap stayed on for close to 30, no, I'm sorry. Surgery was on the 14th and we took that off on the 24th. So 10 days, very quick. I thought it was 30 days, 10 days. And on that 10-day wrap removal, the surgeon had me go straight to therapy, physical therapy, occupational therapy, very similar. In my case, mine was an occupational therapist, but physical therapy, occupational therapy. So, and then in that regard, you're at therapy to do exercises to get your arm, moving in all different ways. This is my good arm. Other ones kind of still stuck. Anyway, so what exercises can you do? Because I will tell you, one weekend after surgery, my husband looked at me and said, Elizabeth, you can't turn into a potato. I don't know if he meant the shape of a potato and me just becoming quite large from sitting and doing nothing, or if he just meant in general, like you can't just sit around and do nothing. And as I was a very active and continue to be active and independent person prior to surgery, it was very difficult for me, someone who has a hard time sitting still, to just be. Because you're not able to move a lot with the huge casted arm. You have pain. You're going to be fatigued. You're going to feel tired, run down, because your energy is dedicated to rebuilding, regenerating that elbow. So yeah, you can't do all the activities you used to do. And you do want to probably get out there and do some exercise. So what exercises can we do? Walking. Walking is a great way to just get up, get the heart rate going, get moving, get some energy moving. And while you may not be able to do a strenuous hike, I talked about in another video related to fall risk, you're kind of a topsy-turvy, weeble-wobble person because you've got an arm, so it's throwing off your balance. So while you may not be able to do a strenuous hike, you can definitely take a vigorous, good-paced walk. Listen to your body, honor your body, see what you can do. Walking. The second one is Qigong. Qigong is a practice that is about cultivating energy within our bodies so that we can use that energy that we grow and channel it out into our everyday experience. The nice thing about Qigong and why it's a good exercise for people healing from elbow surgery is you do not have to bear weight. So you don't put any weight onto your arm. You don't put pressure on your arm. You're not pushing off of a wall. You're not holding a plank position. No pressure on your arm, no weight on your arm. The movements are just very flowing. And I have lots of videos. I'll link up the Qigong playlist to this video. But it's very fluid. And in fact, that can help your arm get greater range of motion because you're flowing through these movements and the arm starts to feel more normal and back to activity that it is used to prior to surgery. So you got walking and Qigong. Another activity, and you might have guessed it, seeing my backdrop here, is yoga. Now, yoga can be a little bit more tricky than Qigong at this point because you're not going to be able to do things like downward facing dog or holding yourself in a plank posture. A lot of the postures where you're bearing weight on your arm could be difficult. And additionally, with your arm being sort of bent, as it straightens out, you may not be able to reach into postures as much as before surgery. However, that's why there are props and assists like blocks and straps and other foam rollers, other things to help you get into postures. So we got walking, qigong, and yoga. Finally, I want to give you insight into an activity I have recently grown to re-love. I loved it as a kid and took some break because as adults, I don't do this often, but my husband and I are getting really into this. So as I mentioned, I'm still healing and I can't fully straighten my arm. So I can't, go to a batting cage. Well, I tried to swing a bat, didn't work. I can throw a ball and I can catch, but really intense physical sports like playing basketball is kind of out of reach. So if I want to exercise and feel active and play a sport, so to speak, what can I do with a bent arm? Well, I can hold a golf club, because you can hold a golf club with one arm relatively straight and one arm is bent. And so my husband and I have really taken up miniature golfing and started going to the driving range, and maybe we'll get into actually playing golf on a course. So you got to kind of be curious. You kind of have to innovate, and you have to figure out, well, what can I do now that my arm has a little bit less strength, is a little bit less flexible, might be a little tired or in a little bit of pain, and may not be all the way straight as I'm used to. So what activities can I do? To recap, you can walk, you can practice qigong, you can flow through a yoga set, or you can try miniature golf or golfing. Anyway, like I said, I do have playlists for yoga videos. So I do chair yoga or seated yoga, gentle yoga. So check out that playlist, and I will link up the qigong playlist to this video. Thanks for tuning in. If you have comments or questions, would love to hear from you below. If you're interested in checking out my blog or other resources, visit my website, elizabethscala.com. And until the next video, enjoy your day.